Listen to me. I want you to pay very, very close attention to what I am about to tell you today, because this single topic, if you get it wrong, can destroy your retirement savings and leave you with health coverage gaps that you simply cannot afford. We are talking about the Medicare Special Enrollment Period. Now, I know the words Medicare enrollment sound dry, complicated, and overwhelming. But I promise you, this is about your money, your security, and your peace of mind. So many of you are turning 65, or you are retiring after working past 65, and you think to yourself, Susie, I don't need to worry about Medicare right now. I missed the open enrollment window, so I'll just wait until next year. Or worse, you say, I have COBRA, so I'm totally covered. Stop. Stand up, take a deep breath, and listen. That line of thinking is a financial trap. If you make a mistake with your Medicare timing, the federal government will slap you with a Part B late enrollment penalty that lasts for the rest of your natural life. Every single month, every single year, you will pay extra out of your pocket, forever. On top of that, you could be left completely uninsured for months, paying full price for prescriptions, doctor visits, and hospital stays. That is money out of your pocket that should be going toward your retirement, your grandkids, or your emergency fund. So what is a Medicare Special Enrollment Period, who qualifies for it, and how do you protect yourself? Let's break this down into real life, because life happens. A Special Enrollment Period, or SEP, is a safety valve. It is a special window of time granted by Medicare that allows you to sign up for Medicare Part A, Part B, Medicare Advantage, or a Part D drug plan outside of the standard initial enrollment period or the annual open enrollment period, without paying a penalty. But, and this is a massive but, you only get an SEP if you experience specific, qualifying life events. The biggest qualifying event, the one where most people get tripped up, is retiring or losing health insurance after age 65 because you or your spouse worked past 65. Here is the scenario: you turn 65, but you are still working at a company with active employee health insurance, or your spouse is working and you are covered under their plan. You say, I don't need Medicare Part B right now because I already have great insurance. That is completely fine. You are allowed to delay enrolling in Medicare Part B as long as you have creditable coverage based on current active employment. Then the day comes when you or your spouse decides to retire. Your active job coverage ends. What happens now? You enter an 8-month special enrollment period. This 8-month window starts either the month after your employment ends or the month after your group health coverage ends, whichever happens first. Now, do not wait until month 7. Do not wait until month 8. Why? Because if you wait, you will have a gap in coverage. You want your Medicare Part B to start the very first day your employer coverage ends. You should actually start the paperwork 2 to 3 months before your last day of work. And here is the dangerous trap that I need you to write down right now. COBRA is not active employment coverage. Retiree health plans are not active employment coverage. I hear this all the time: Susie, I left my job, but my employer gave me 18 months of COBRA, so I'm going to wait until COBRA ends to sign up for Part B. No! Do not do that. The Social Security Administration does not view COBRA as active job-based insurance. If you rely on COBRA and miss your 8-month special enrollment period from the date your employment actually ended, you will be penalized. When you finally try to sign up, Medicare will say, sorry, you missed your window. You will have to wait for the general enrollment period, face a lifetime penalty, and go months with zero coverage. What about other life events? What if you already have Medicare, but your life changes? There is another type of special enrollment period, and this one typically lasts for 2 months. Did you move? If you move to a new zip code, a new state, or out of your planned service area, your current Medicare Advantage or Part D plan might not cover you there. Moving opens a 2-month special enrollment period to pick a new plan that fits your new home. If you tell your plan before you move, your window starts the month before you move and goes for 2 full months after. If you tell them after, your window is 2 months from the month you moved. Did you lose your secondary coverage involuntarily? Maybe your former employer dropped its retiree drug coverage, or your plan stopped operating in your county. That gives you a 2-month SEP to get a new Part D or Medicare Advantage plan so you don't face prescription coverage gaps. Did your financial situation change? If you become eligible for Medicaid or Extra Help, the federal program that assists with prescription costs, you get a special enrollment period to adjust your coverage. So, what is your actionable takeaway today? How do you protect yourself right now? First, if you are working past 65 or covered by a working spouse, verify with your employer's HR department, in writing, that your health coverage is considered creditable group health coverage for a company with 20 or more employees. If the company has fewer than 20 employees, Medicare is primary, and you usually must sign up for Part B at age 65 anyway to avoid penalties. Second, the moment you decide to retire, get Form CMS-L564. This is the Request for Employment Information form. Your employer fills out their part to prove you had continuous coverage based on active employment, and you fill out Form CMS-40B to apply for Part B. Take those forms directly to Social Security before your job coverage ends. Third, mark your calendar. Do not confuse the 8-month Part B window with the 2-month window for Medicare Advantage, Part C, or prescription drug, Part D, plans. While you have 8 months for Part B, you only have 2 months, or 63 days, after job coverage ends to join a Medicare Advantage or Part D plan without a prescription penalty. That means your real deadline is 2 months, not 8. Knowledge is power, but action is security. Do not let bureaucracy or misunderstandings drain your hard-earned retirement dollars. Take control of your healthcare today, verify your enrollment dates, and stand tall in your financial security.